Good morning, member of management. I'm so glad I ran into you here while we're both waiting for the elevator. I was actually wanting to discuss with you a project that I was working on regarding healthcare associated infections. Do you have a couple of minutes to discuss this while we're both in the elevator? Thank you. So, I would like to talk to you about healthcare associated infections, particularly in the neonatal intensive care unit. I'm currently working as a NICU nurse, and throughout my time, I've noticed that a lot of premature neonates have a prolonged stay in the NICU due to a variety of disease processes such as prematurity, infections, congenital heart problems, respiratory issues, genetic disorders, and a lot of times they require fluid replacement and nutrition, which is given through peripheral IVs, and more times than not, it's through central lines such as PICC lines. And because of the prolonged period of time that they're there, and this central line is in them, they have an increased risk of infection. So, as NICU nurses, not all nurses are trained or certified to insert these lines. However, all NICU nurses are trained to maintain and give medication, give medications through these lines. So I think it's very important that all of us are knowledgeable regarding how to prevent uh, central line associated infections, otherwise known as CLABSIs. And because NICUs account for 38% of highs of all ICUs, that's a pretty large percentage. So there definitely needs to be more knowledge regarding how to prevent and also reduce this. And we can do this through the use of informatics. Particularly as technology is advancing, we can use the electronic health record to reduce highs. So, one of the proposals I have is kind of modifying the electronic health record to be unit specific. So, in the NICU, a lot of these babies do have central lines. So, having different flow sheets where NICU nurses can go in and document the interventions that they took. So, whether it be cleaning the port of the tubing with an alcohol-based rub, or even using Kuros caps, and also having physicians or nurse practitioners document the need on a daily basis regarding the central line. So this would ensure that we aren't keeping the central line in the neonate for a longer period of time when it may not be necessary for um, their plan of care or for their nutritional health. And also, something else we can do is that we can track this through flow sheets about who is maintaining the line, who is doing rounds on these lines to ensure that for adequate placement, and to ensure as far as um, the upkeep of the line, it is up to date. That would reduce any infection. So having these additional central line care bundles in flow sheets would help us NICU nurses to make sure that we are able to provide adequate care, and this would reduce the overall need for readmissions to the department or any complications that may be associated with central line infections that a lot of times are occurring in hospitals, and this is prolonging the neonate stay. So, of course, this is increasing medical costs, and also a lot of times some can lead to mortality and morbidity rates increasing, not only for the healthcare organization but also for the department. So, some considerations to this would be just, as a nurse informatist, that we can implement these interventions into the electronic health record to ensure that we are monitoring how many days the central line is in place. And also, as NICU nurses, we are able to document the correct interventions that we're taking so that in case it ever shows up in a lawsuit or anything like that, there is documentation that we are adequately caring for these lines and we are liable for any infections that may occur. Thank you so much for taking the time out of your day to speak with me.